Non-consensual pelvic under anesthesia. Posting for a friend. She had sinus surgery today. When she woke up from anesthesia, she could talk. Something was off. She went to the bathroom and found that she also had leftover lube on her. She's a sexual assault survivor that still struggles. Waking up from surgery with a rooted face and what felt like a broken jaw just further escalated the mental response. She's been crying since she woke up, which is not good when you've had sinus surgery. She's feeling a whole shutdown coming on. Point is, she never in 100 years would have consented to this. Ever. I'm not sure if the surgery was done in KY or Indiana, but I'm betting KY. No, I can't ask her, she's asleep. Is this legal? If so, how? I understand medical students need training, but this was done to her without her consent. Training should be done on consensual patients. This has caused an ugly mental health crisis for her. Other people are giving details about catheters, and I did want to chime in that if your friend did receive a pelvic exam while under anesthesia, that is legal in both Indiana and Kentucky. Neither state requires consent, and only 20 do. Link. It's been posted about a few times. Depending on the hospital and the waiver signed, your friend may have had a pelvic exam done in an effort to teach medical students. I believe other examples have also said they were not aware of the exam until after the surgery. Your friend should be able to contact the hospital and find out if this is the case. If so, she should definitely go over a copy of the consent form and verify if it is in there. If not, contact a lawyer to see if you have a case. Your friend, however hard it may be, needs to contact the department and ask for clarification of what happened. An advocacy service could assist her with this process. Most of the advice on here is either from non-clinical people who have Googled, cited opinions, or from healthcare professionals from various locations with possibly differing practices depending on state, country. None of whether it is legal or what actually happened, however, takes away the violation your friend feels. I work within governance in healthcare now, and also as an SA victim where it happened when I was unconscious. If this were me, I would be devastated too. The legalities or standards practices don't take away the feeling of the lack of control your friend feels over this happening, and I'm so sorry it's happened to her. Call medical records and ask for a copy of your intraoperative surgical notes. Have them send any nurse notes, anesthesia notes, and doctor's records. A catheter placement would be documented in there. If no catheter was documented, further ask to have them send your consent to see if something was mentioned in small writing about a vaginal exam. If not, call the state medical board. They will help answer questions for you in regard to physician scope of practice. You can also ask the hospital for their policy about vaginal exams under anesthesia. You can call a lawyer with all of that information. You can of course call one sooner, but may have to pay for them to discover these same facts. I hope that is helpful. Former RN administrator. Furnit. Unfortunately, she probably did get a non-consensual pelvic and it was probably perfectly legal. The law is really fucked up about it. I'm not saying it's okay. I'm saying she probably has very little recourse. Write your congressman on her behalf. What state? Was it a teaching hospital? It's actually not uncommon for hospitals to have medical students practice pelvic exams on unconscious patients. Link. Furnit. Pelvic exams under anesthesia, without consent, are legal in both Kentucky and Indiana. Sounds like her surgery was pretty intense if she woke up feeling like she had a broken jaw. The lube was because they cathed her in case she urinated during the surgery. The bad part is, they should have informed her prior to the surgery that they would need to insert the catheter. So many medical professionals do not consider the ramifications of surprising a patient by doing that on a sexual assault survivor. Has she read the papers she signed? Unknown yet. She's still recovering pretty bad and has not responded. That's really pretty important. The most likely situation here is not that she had a pelvic exam, but that she had a catheter inserted during surgery, which is very common. An experienced nurse does this in a few seconds and removes it after surgery is done. It beats peeing all over yourself. Furnit. Furnit. The doctor should explain the catheter placement prior. The CDC indications for catheter placement is very limited and a sinus surgery would be unusual. The records can be found if you download the hospital app. Epidural use can increase retention, but you can't really use one on a face. So, it would be likely IV meds and gases. Furnit.